Question 1. A patient presents with uncontrolled hypertension. Which ICD-10-CM code category would you most likely use to report this condition? A. I-25. B. I-10. C. I-11. D. I-50. Answer: B. I-10. This question tests your knowledge of ICD-10-CM coding for hypertension. The keyword uncontrolled hypertension points you toward code specifically for high blood pressure, and category I-10 is the core code for essential, primary, hypertension, which is the most common type. While other codes exist for hypertension with complications or in specific conditions, I-10 is the fundamental starting point for uncomplicated or unspecified hypertension, including when it is stated as uncontrolled. For example, you would code I-10 for a patient whose blood pressure remains elevated despite medication. Remember that I-10 is the general code for high blood pressure. Question 2. A physician performs a Level III office visit for an established patient. According to CPT guidelines for E/M coding based on medical decision-making, MDM, which element must be met for a Level III? A. High complexity MDM. B. Moderate complexity MDM. C. Low complexity MDM. D. Straightforward complexity MDM. Answer: C. Low complexity MDM. This question focuses on the medical decision-making, MDM, element in CPT evaluation and management, E/M, coding, specifically for an established patient Level III visit. CPT guidelines link specific MDM levels to the overall E/M service levels. A Level III visit, CPT codes 99213 for established or 99203 for new, requires at least low complexity MDM. MDM complexity is determined by factors like the number and complexity of problems addressed, the amount and complexity of data reviewed, and the risk of complications and/or morbidity/mortality. For instance, managing two stable chronic conditions or evaluating a new problem requiring limited data review typically supports a low MDM. Think of Level III as the middle ground requiring low MDM. Question 3. Which anatomical term describes a position away from the midline of the body? A. Medial. B. Lateral. C. Anterior. D. Posterior. Answer: B. Lateral. This question tests your understanding of basic anatomical directional terms. The keyword away from the midline is the key definition you need. Lateral means toward the side, further away from the imaginary line splitting the body into left and right halves. Medial means toward the midline, anterior means toward the front, and posterior means toward the back. For instance, your ears are lateral to your nose, which is medial. Remembering lateral relates to the side helps distinguish it from other terms. Question 4. A physician removes a benign lesion from the patient's arm. In CPT, how is the code selection for lesion removal typically determined? A. Size of the lesion only. B. Location of the lesion only. C. Size and location of the lesion. D. Depth of the excision. Answer: C. Size and location of the lesion. This question is about CPT coding for skin lesion excisions. CPT guidelines for lesion removal codes, like those in the integumentary system chapter, explicitly state that code selection is based on both the size of the excised lesion, including margins, and its location on the body. The depth of the excision is a factor in some procedures but not the primary determinant for standard benign or malignant lesion removal codes. For example, Removing a 2.0 cm benign lesion from the arm codes differently than removing a 2.0 cm benign lesion from the face. Always check both size and location when coding lesion excisions. Question 5. What does the medical term hepatomegaly mean? A. Inflammation of the liver. B. Enlargement of the liver. C. Liver cancer. D. Liver failure. Answer B. Enlargement of the liver. This question tests your medical terminology knowledge, specifically breaking down a compound term. Hepato- is the combining form for liver, and megaly is a suffix meaning enlargement. Therefore, hepatomegaly directly translates to enlargement of the liver. This term describes a physical finding often noted during an examination. Knowing common prefixes, root words, and suffixes is essential for understanding medical terms. Megaly consistently indicates enlargement. Question 6. When reporting supplies used during a procedure in a physician's office, which coding system is typically used? A. ICD-10-CM. B. CPT. C. HCPCS Level II. D. DSM-5. Answer C. HCPCS Level II. This question asks about the correct coding system for supplies used in a physician's office setting. While CPT is for procedures and ICD-10-CM is for diagnoses, the Healthcare Common Procedure Coding System, HCPCS, Level II is primarily used to report supplies, durable medical equipment, injections, and other services not included in CPT. These codes start with a letter followed by 4 numbers, e.g., J codes for drugs, A codes for transportation/supplies. For instance, a specific type of cast material used during a fracture care visit might be reported with a HCPCS Level II code. Remember, HCPCS Level II is for products, supplies, and certain services not found in CPT. Question 7. Which of the following is a key component of the history section when determining the evaluation and management, E/M, code level? A. Complexity of problems. B. Amount of data reviewed. C. Risk of complications. D. Review of systems, ROS. Answer D. Review of systems, ROS. This question assesses your understanding of the components of an E/M service history. The history is one of the 3 key components, along with examination and medical decision-making, under the older 1995/1997 E/M guidelines, and still relevant under the 2021 Plus guidelines focusing on history and exam as documented elements that contribute to the overall complexity. The review of systems, ROS, which is a series of questions about body systems to identify symptoms, is a defined part of the history component, along with the chief complaint, CC, history of present illness, HPI, and past, family, and social history, PFSH. The complexity of problems, amount of data, and risk are elements of medical decision-making, not history. Focusing on the structured parts of the E/M note helps identify which component is being referenced. Question 8. A patient is diagnosed with type 2 diabetes mellitus with diabetic retinopathy. In ICD-10-CM, how is this condition typically coded? A. Code for type 2 diabetes only. B. Code for diabetic retinopathy only. C. Combination code that includes both the diabetes and the retinopathy. D. 2 separate codes, one for diabetes and one for retinopathy. Answer C. combination code that includes both the diabetes and the retinopathy. This question tests your knowledge of ICD-10-CM coding conventions, specifically combination codes. ICD-10-CM provides combination codes that link a primary diagnosis, like diabetes, with a related manifestation or complication, like retinopathy. When such a combination code exists and accurately describes the documented condition, it should be used instead of coding each component separately. The ICD-10-CM index and tabular list guide you to these specific codes, often found in categories like E08, E13 for diabetes with complications. For example, E11.311 is a combination code for type 2 diabetes mellitus with specified ophthalmic complication, diabetic retinopathy with macular edema. Always look for combination codes when one condition is a direct result or manifestation of another. Question 9. What is the primary purpose of the CPT codebook? A. To classify diseases and injuries. B. To report medical procedures and services. C. To describe medical equipment and supplies. D. To define medical necessity. Answer. B. To report medical procedures and services. This question asks about the core function of the CPT codebook. CPT, which stands for Current Procedural Terminology, is the coding system used to report medical, surgical, and diagnostic procedures and services performed by physicians and other healthcare professionals. ICD-10-CM is for classifying diagnoses, HCPCS Level II is for supplies and other services, and medical necessity is a clinical determination, not a coding system. Think of CPT as the language used to tell payers what the provider did for the patient. Question 10. What is the standard number of characters in a fully specified ICD-10-CM diagnosis code? A. 3 characters. B. 5 characters. C. At least 3 characters, up to 7 characters. D. Exactly 7 characters. Answer. C. At least 3 characters, up to 7 characters. This question tests your understanding of the structure of ICD-10-CM codes. While many codes are 4 or 5 characters, ICD-10-CM codes have a variable length, requiring at least 3 characters for a category but extending up to 7 characters for the highest level of specificity, often including a 7th character extension for things like episode of care, initial, subsequent, sequela. A 3-character code represents a category, and subcategories and individual codes add more characters, with the 7th character providing crucial detail for injuries, external causes, and certain other conditions. So, codes range from a minimum of 3 to a maximum of 7 characters. Question 11. Which term means pain in a joint? A. Myalgia. B. Neuralgia. C. Arthralgia. D. Cephalgia. Answer. C. Arthralgia. This question tests your ability to break down medical terms related to pain. The suffix algia means pain. You need to identify the root word that means joint. Arth/o is the combining form for joint. Myalgia means muscle pain, neuralgia means nerve pain, neur/o-, and cephalgia means headache, cephal/o-. Therefore, arthralgia is the term meaning joint pain. Focus on identifying the root word related to the anatomical location or structure. Question 12. What does the acronym HCPCS stand for? A. Healthcare Common Payment Coding System. B. Health Coverage and Patient Care Standards. C. Healthcare Common Procedure Coding System. D. Hospital and Clinical Procedure Classification System. Answer: C. Healthcare Common Procedure Coding System. This question asks for the full name that the acronym HCPCS represents. HCPCS stands for Healthcare Common Procedure Coding System. It is a collection of codes representing procedures, supplies, products, and services that may be provided to Medicare and Medicaid beneficiaries and to patients enrolled in private health insurance programs. Knowing the full name helps understand its purpose as a coding system for healthcare procedures and related items. Question 13. A patient receives an injection of 10 units of a specific medication in the office. How would this typically be reported using HCPCS Level II codes? A. Using a CPT code for the administration only. B. Using an ICD-10-CM code for the medication. C. Using a HCPCS Level II J code for the medication. D. Using a CPT code for the medication itself. Answer: C. Using a HCPCS Level II J code for the medication. This question focuses on coding for administered medications in a physician's office setting. While a CPT code might be used for the administration of the injection, e.g., 96372, the medication itself is typically reported using a specific type of HCPCS Level II code, often a J code. J codes describe injectables and chemotherapy drugs and specify the dosage unit included in the code descriptor. For example, J0880 might describe a specific drug, and the number of units reported corresponds to the dosage given. Remember that HCPCS Level II is used for reporting drugs and supplies. Question 14. What is the definition of a sequela in ICD-10-CM coding? A. The original injury or condition. B. The acute phase of an illness. C. A residual condition produced after the acute phase of an illness or injury has terminated. D. A complication that occurs during the acute phase of an illness. Answer: C. A residual condition produced after the acute phase of an illness or injury has terminated. This question tests your understanding of a specific ICD-10-CM coding term, sequela. A sequela refers to a condition that remains after the initial illness or injury has resolved or passed its acute phase. It is a residual effect, not the original injury or an acute complication. For example, paralysis remaining after a stroke is considered a sequela of the stroke. When coding a sequela, you typically need two codes, one for the sequela itself and one for the original condition causing the sequela, using a specific seventh character for sequela where applicable. Understanding that a sequela is a late effect is crucial. Question 15. A patient sees their primary care physician for management of their stable type 2 diabetes and presents with a new complaint of poison ivy. The physician addresses both issues during the visit. How would this scenario typically affect the medical decision-making, MDM, level for the E/M service? A. It would decrease the MDM complexity because one condition is stable. B. It would increase the MDM complexity due to addressing a new problem and managing a chronic one. C. It would not affect the MDM complexity. D. MDM is only based on chronic conditions. Answer: B. It would increase the MDM complexity due to addressing a new problem and managing a chronic one. This question relates to how different types of patient problems affect the medical decision-making, MDM, component of E/M coding. The number and complexity of problems addressed is a key element of MDM. Managing a stable chronic condition contributes to complexity, but addressing a new problem, especially one with a workup, even if simple like poison ivy, adds further complexity. Therefore, managing both a stable chronic condition and a new problem will increase the overall MDM complexity compared to just managing a single stable chronic condition. The more issues, especially new ones or those requiring significant workup, the higher the MDM. Question 16. Which coding system is used for inpatient hospital procedures? A. CPT. B. HCPCS Level II. C. ICD-10-CM. D. ICD-10-PCS. Answer: D. ICD-10-PCS. This question asks about the coding system used specifically for inpatient hospital procedures. While CPT is used for physician procedures and outpatient services, the ICD-10 procedure coding system, ICD-10-PCS, is the HIPAA-mandated system for reporting inpatient hospital procedures in the United States. ICD-10-CM is for diagnoses in all settings, and HCPCS Level II is for supplies/services. ICD-10-PCS has a unique 7-character alphanumeric structure specific to inpatient procedures. Knowing this distinction is vital for hospital coding. Question 17. What is the anatomical location referred to by the term proximal? A. Away from the point of origin or midline. B. Toward the point of origin or midline. C. Toward the front of the body. D. Toward the back of the body. Answer: B. Toward the point of origin or midline. This question tests your understanding of anatomical directional terms, specifically proximal. Proximal describes a position that is closer to the point of attachment or origin of a body part, or closer to the center of the body. For example, your elbow is proximal to your wrist because it's closer to your shoulder, the point of origin for the arm. Distal is the opposite, meaning further away. Think of proximal as being nearby the core or origin. Question 18. According to CPT guidelines, what is the definition of a new patient for E/M coding? A. A patient who has not been seen by any physician in the practice within the past 3 years. B. A patient who has not been seen by the physician or another physician of the exact same specialty in the same group practice within the past 3 years. C. A patient who is seeing the physician for a completely new problem. D. Any patient seen for the first time by a specific physician. Answer: B. A patient who has not been seen by the physician or another physician of the exact same specialty in the same group practice within the past 3 years. This question tests a fundamental CPT guideline for E/M coding, the definition of a new versus established patient. CPT defines a new patient as one who has not received any professional services from the physician or another physician of the same exact specialty belonging to the same group practice within the past 3 years. It's specific to the specialty and group practice, not just any physician or the specific problem. For example, if a patient saw a cardiologist in a large multi-specialty group 2 years ago, they would be considered an established patient if they see another cardiologist in the same group, but a new patient if they see a dermatologist in the same group. Pay close attention to the same specialty and same group practice criteria. Question 19. A coder finds conflicting information in the ICD-10-CM alphabetic index and tabular list for a specific condition. Which resource takes precedence? A. The alphabetic index. B. The tabular list. C. The physician's documentation. D. Official ICD-10 CM coding guidelines. Answer B. The tabular list. This question addresses a crucial ICD-10 CM coding convention regarding conflicting information. While you always start by looking up terms in the alphabetic index, the ICD-10 CM tabular list always takes precedence over the alphabetic index when there is a discrepancy. The tabular list contains the full code descriptions, inclusion and exclusion notes, and other essential information that must be reviewed before assigning a final code. Official coding guidelines provide instructions but don't replace the structure of the codebook itself. Physician documentation provides the information to be coded. Always verify your index lookups in the tabular list. Question 20. What is the purpose of a CPT modifier? A. To report a patient's diagnosis. B. To indicate that a service or procedure performed has been altered by some specific circumstance but not changed in its definition or code. C. To identify the physician performing the service. D. To specify the type of insurance coverage. Answer B. To indicate that a service or procedure performed has been altered by some specific circumstance but not changed in its definition or code. This question asks about the function of CPT modifiers. Modifiers are two-character codes appended to CPT codes to provide additional information about the service performed without changing the basic definition of the code. They indicate that a service was altered in some way, such as being performed bilaterally, by more than one surgeon, or only partially completed. Modifiers are not used for diagnoses, physician identification, or insurance information. Think of modifiers as providing necessary details about how the procedure code should be interpreted in a specific situation. Question 21. Which medical term means surgical removal of the appendix? A. Appendicitis. B. Appendectomy. C. Appendoscopy. D. Appendostomy. Answer B. Appendectomy. This question tests your knowledge of surgical suffixes in medical terminology. The suffix ectomy means surgical removal. Append/o is the combining form for appendix. Therefore, appendectomy means surgical removal of the appendix. Appendicitis is inflammation of the appendix, appendoscopy is visualization of the appendix, and appendostomy is creating an opening into the appendix. Focusing on the suffix and the root word helps you define the term. Question 22. When coding for a patient who fractured their tibia 2 months ago and is now presenting for routine follow-up and cast change during the healing phase, which type of seventh character would typically be used in the ICD-10 CM fracture code? A. Initial encounter. B. D. Subsequent encounter. C. S. Sequela. D. P. Other and unspecified injury. Answer B. D. Subsequent encounter. This question focuses on the appropriate seventh character for fracture coding in ICD-10 CM. For injuries like fractures, the seventh character specifies the episode of care. A. Initial encounter is used for the period when the patient is receiving active treatment for the injury. D. Subsequent encounter is used for routine follow-up care during the healing phase. S. Sequela is used for complications or conditions that arise after the initial injury has healed. Since the patient is in the healing phase and receiving follow-up, D is the correct seventh character. Remember, the seventh character helps track the patient's progress through the treatment and recovery of an injury. Question 23. What does the acronym EMR or EHR commonly refer to in a healthcare setting? A. Emergency medical responder. B. Electronic medical record or electronic health record. C. Evaluation and management report. D. Estimated medical revenue. Answer B. Electronic medical record or electronic health record. This question asks about common acronyms used in healthcare administration and technology. EMR stands for electronic medical record, and EHR stands for electronic health record. These terms refer to the digital versions of patients' charts or health information used for documenting visits, ordering tests, and managing patient care electronically. Evaluation and management, E/M, relates to visit coding, not the record system itself. Knowing these common acronyms is helpful in the healthcare environment. Question 24. A physician provides counseling to a patient during a routine office visit. According to CPTE/M guidelines, 1995/1997 framework, what is a requirement for using time as the basis for selecting the E/M code level? A. Counseling and/or coordination of care must comprise more than 25% of the total visit time. B. Counseling and/or coordination of care must comprise more than 50% of the total face-to-face time with the patient and/or family. C. Counseling time cannot be used to determine the E/M level. D. Time can only be used for billing hospital visits, not office visits. Answer B. Counseling and/or coordination of care must comprise more than 50% of the total face-to-face time with the patient and/or family. This question tests your understanding of using time as a key component for E/M code selection under the older 1995/1997 guidelines, which are still sometimes referenced or used for certain services. Under these guidelines, time can be the determining factor for code selection when counseling and/or coordination of care dominate the visit, defined as constituting more than 50% of the total face-to-face time for office visits, or unit/floor time for inpatient visits. The content of the counseling must also be documented. For the 2021 plus E/M guidelines, time is often the primary determinant for code selection when MDM is not used. Remember that using time requires documentation showing counseling dominated the visit under the 1995/1997 rules. Question 25. What is the anatomical location described by the term superior? A. Below another structure. B. Above another structure. C. Toward the front of the body. D. Toward the back of the body. Answer B. Above another structure. This question tests your knowledge of basic anatomical directional terms, specifically superior. Superior means situated toward the head and away from the feet. It describes a position above another body part. Inferior is the opposite, meaning below. Anterior means toward the front, and posterior means toward the back. For example, your heart is superior to your stomach. Think of superior as meaning higher up in the body.